Hello, this is Dr. David Allen from North Augusta Pediatrics. I want to talk to you today about coronavirus. All of us have been hearing about coronavirus in the news. It's a new illness that has come out of China and is spreading around the world, causing some serious illness in older people and in people with serious medical problems. The good news for my pediatric population is that it doesn't seem to be causing serious illness in children. It doesn't appear to be any worse than getting the flu. We've seen a lot of flu this year. We haven't seen any coronavirus yet, but it may still get here. I wanted to answer any questions that you might have about coronavirus and how we diagnose it and how we treat it and what the future holds. Right now, there is no rapid testing that can be done in our office. We can't do a rapid test like we do for strep or for flu or for RSV in our office. If a patient meets the criteria for possible coronavirus infection, we send them to the emergency room to have the testing done, or we send them to the health department. But they have to meet certain criteria. They have to have the symptoms of coronavirus, which are the same things as flu. Those symptoms are fever and cough, runny nose, just feeling bad. But they have to have other things going on as well. They need to have traveled outside the country to a place that is known to have coronavirus, or a place in the country where it's known to have coronavirus, or they need to have been exposed to someone who has coronavirus. If these criteria are not met, we are not going to send them for testing. The CDC, which is our government organization that takes care of this sort of thing, has said that we should only test patients who meet these particular criteria. There's some testing going on in Augusta right now with some potential patients with coronavirus, adults who were out of the country, came from an area where there was coronavirus. Hopefully it won't enter our pediatric population, but it might. But again, I want to reassure you that this is not a serious problem for your children. Grandparents, it's more of a serious problem. The CDC is even advising people my age and older to avoid large crowds. All of us should be using good hand washing technique. We should not be shaking hands with people. We should not be hugging people. We should keep our hands to ourselves and try to keep the spread of the germs to a minimum. People ask about using masks. Now, masks are not necessary. Masks should only be worn by those people who are already sick. If you think about it, when you put on a mask and you're not sick, it's not preventing you from getting sick. Because when you breathe, the air that you breathe actually comes in around the side of the mask and it still goes in here. It does not come through the mask. It takes the easiest area to pass through, which is around the side of the mask, into your mouth. It doesn't keep you from getting sick. People who have coronavirus or other viruses, if they wear a mask, then it does collect some of those particles in the mask as they breathe out, and certainly as they sneeze or cough. When you sneeze or cough, it can send germs up to 15 feet away. So the masks are only necessary for people who are already sick. You do not need to put masks on your children or yourself to prevent illness. It's only if you are already sick. If your children develop any symptoms similar to coronavirus, such as fever and chills and aches and pains and cold symptoms, give us a call. It's probably the flu. It's probably not coronavirus. And you can come into our office and we can check you for the flu and make sure which one it is. But again, we cannot test in the office for coronavirus. We would have to send you somewhere else for that. This is an illness that we hope will go away this summer, just like the flu does. We don't see any flu in the summertime because for some reason the warmer weather makes it go away. So that's what we hope will happen with this particular illness as well. But we won't know yet, because it's a new virus. Came from an old virus, another coronavirus, but this is something new, so we don't know everything about it yet. If you have any questions about it, just give us a call.